Have you ever been sitting in class or at work and suddenly you feel it? Your heart skips a beat? You feel a weird fluttering or thudding sensation in your chest? So let's get started. You might even feel your pulse racing in your neck or wrist. And then you start to worry. Is it just stress, anxiety, or is it something serious? Well, today we'll dive into exactly how to tell the difference between harmless heart palpitations and those that you should never ignore. They usually go away on their own once the trigger is gone. While most palpitations are harmless, there are certain types that you should never ignore because they can be signs of a more serious issue. Prolonged palpitations can indicate an underlying heart condition that needs attention. Let's discuss 5 warning signs that your palpitations might be something more than just stress. This could mean your heart isn't pumping enough blood to your brain, which can be a sign of a serious issue. But before we move on to the more serious types of palpitations, I wanted to emphasize that even if you think your palpitations are just stress-related, it's still important to see your doctor. Palpitations could be a sign that you're at risk of developing a heart condition. Trouble breathing along with palpitations can indicate a problem with your heart's rhythm or another heart condition. Why? Well, chronic stress can actually harm your heart health in the long run. Doctors need as much detail as possible to make the right call. So here's what you should pay attention to. When did it start? If your palpitations raise concern, a doctor may run one or more of these tests. Heart palpitations in a healthy 25-year-old are usually not the same as in a 65-year-old with diabetes. Your doctor considers your age, medical history, family history of heart disease, blood pressure and cholesterol levels, smoking or alcohol habits, etc. The same symptom can mean different things for different people. That's why understanding your personal context is so important. An electrocardiogram, ECG, or EKG, this test measures your heart's rhythm and can detect any abnormalities. Holter monitor. The good news is yes, absolutely. In many cases, here are some lifestyle tips to help you reduce palpitations. Limit caffeine. Energy drinks and coffee can make palpitations worse, so try to drink less of them. Stay hydrated. Dehydration can trigger irregular rhythms, so drink enough water throughout the day. Get enough sleep. Aim for 7 to 9 hours of sleep each night. Poor sleep can make palpitations worse. Manage stress. Practice stress-reducing techniques like meditation, walking, or journaling. Cut back on alcohol and smoking. Both can affect heart rhythm and make palpitations worse. Eat potassium-rich foods. Foods like bananas, sweet potatoes, and spinach can help regulate heart rhythm and lower blood pressure. Exercise regularly. Exercise can improve overall heart health. Start slow and build up gradually. This is a wearable version of the ECG that you can use for 24 to 48 hours. As I said earlier, it's better to be safe than sorry. So here's a simple rule to follow. If you have palpitations plus any of these symptoms, call a doctor or go to the nearest emergency room. Chest pain, fainting or near fainting, severe shortness of breath, palpitations lasting over 15 minutes, weakness or confusion. Echocardiogram. This test uses sound waves to create images of your heart to check its structure and function. Blood tests. Remember, check for underlying causes, look out for warning signs, and don't hesitate to seek medical help when needed. Thanks for watching. These tests can check for thyroid issues, anemia, or electrolyte problems, and a stress test. During this test, your doctor monitors your heart as you exercise to see if that triggers palpitations or other issues. How long did it last? What were you doing when it happened? What did it feel like? Did you feel dizzy, weak, sweaty, or short of breath? Any chest discomfort? The more details you can provide, the better. You may even want to keep a log or journal if this happens often. And there are even heart rate apps that can track episodes, so it's crucial to manage stress and find healthier ways to cope with it. Your doctor can help you identify sources of stress in your life and suggest strategies like mindfulness, meditation, yoga, or regular exercise to help you relax. Anxiety can feel a lot like heart trouble. When you're anxious, your body releases adrenaline, which increases heart rate. This can cause rapid breathing, sweating, and chest tightness. But the key difference is that these symptoms usually ease when you calm down. If deep breathing, walking, or resting helps, it's more likely anxiety. But if symptoms persist despite your efforts to calm down, don't assume it's just stress. Plus, There might be underlying medical conditions contributing to your stress or anxiety that your doctor can help you identify and treat. Also, there are times where persistent palpitations may indicate a serious issue, even if they feel stress-related. More on that later. So here's a list of common causes of harmless palpitations. First, stress or anxiety. You see, when you're stressed, your body releases hormones like adrenaline, which increase your heart rate. This extra beating can sometimes trigger palpitations. Next, caffeine or energy drinks. Caffeine stimulates your nervous system and makes your heart beat faster. So drinking too much coffee or energy drinks can make palpitations worse, or even trigger them. This is especially true if you're at risk for heart disease. Lack of sleep. When you don't get enough sleep, you might feel more anxious and stressed, which can lead to palpitations. Dehydration. When you're dehydrated, your body doesn't have enough fluids to properly transport blood, so your heart has to work harder, sometimes leading to palpitations. Exercise, especially intense workouts. During exercise, your heart pumps faster to deliver more blood to your muscles. But if you push yourself too hard or don't cool down properly, you might experience palpitations afterwards. Hormonal changes, especially in women, hormonal shifts like during menstruation, pregnancy, or menopause can affect heart rhythm and trigger palpitations. Certain medications, some medications like asthma, inhalers, or cold meds, can cause palpitations as a side effect. Low blood sugar. When your blood sugar drops too low, your body goes into a state of stress, triggering palpitations. If you stay with me all the way to the end, I'll give you an easy cheat sheet to help you spot the warning signs and know when to call for help. First off, I want to explain what heart palpitations are. Simply put, heart palpitations are the awareness of your heartbeat. You can experience them as a flutter, a skipped beat, a thud, a racing heart, or a pounding in your chest or neck. Most people get them from time to time, and they can last a few seconds or minutes and come and go without warning. Some people feel them only at night. Others feel them when anxious, dehydrated, or even just sitting still. There are two main categories of palpitations. We'll talk about the less serious ones first, and then move on to the more concerning ones. In most cases, these types of palpitations don't require emergency care. Alright, so what kind of palpitations should you never ignore? No. 1. Palpitations that last longer than 10 minutes, especially if you're resting and they won't go away. No. 2. Dizziness or fainting. If you feel lightheaded, dizzy, or even faint while experiencing palpitations, it's important to seek medical help right away. No. 3. Chest pain or pressure, along with palpitations, could signal a blocked artery, or even a heart attack. No. 4. Shortness of breath, especially when it happens suddenly. And no. 5. If you have a history of heart disease. If you or your family have a history of heart conditions, don't take any chances. So if you ever experience these warning signs, please contact your doctor or seek medical attention right away. Next, let's talk about how to describe your symptoms to a doctor. Now let's talk about what kind of tests a doctor might order. Now let's explore another common cause of palpitations: anxiety. Let's look at how age and risk factors matter. Now let's talk about prevention. Can you prevent palpitations? Finally, let's talk about when to call for help. In conclusion, most heart palpitations are harmless, but some can be serious. Knowing the difference can save your life.